Hello and welcome to my presentation on improving documentation in a Maryland secondary school. The overview of this project, I'll be talking about the problem and background of the research that I found and the assessment and PDSA cycles of the project, the quality improvement project that I implemented in my secondary school. And then finally, I will be reviewing the lessons and limitations as well as the conclusion of the project. Healthcare today is focusing more on documentation being used for patient and physician communication, developing a specific plan of care, and for assessment of outcomes. However, this is not being utilized as much in the secondary school setting, and problems for this include a lack of accountability for standards set forth by the NATA, including the best practice guidelines for athletic training documentation that was set forth in 2017, and the secondary school value model, which was published in 2015. For the secondary school value model, they went through each part of documentation that should be present in the athletic training facility, and this includes daily sign-in, injury evals, communication logs, treatment logs, hours worked, hydration and weight logs, daily soap notes, and notes from coaches, parents, nurses, and physicians. The second problem is documentation that is in place may not show the athletic trainer's worth or value. The documentation is a tangible evidence of the value that the athletic trainer is showing for the secondary school to their employer, which may be a PT company or a hospital, or the secondary school itself. And without this tangible evidence, it's easier for an athletic trainer to possibly lose their job. Third is a perceived lack of time. In 2017, athletic trainers were interviewed, and lack of time was one of the biggest perceived barriers to quality documentation, and one of the main reasons why the athletic trainers were feeling like they were doing multiple things at once, and that documentation was becoming less of a priority when they're dealing with multiple athletes and other things that they have to do all at the same time. Use of multiple documentation formats, including an EMR system versus pen and paper. Hospital systems, PT companies, physicians are all kind of using the EMR system, whereas secondary schools may not have the use of in EMR. They may not be able to pay for it, and maybe just be easier to use a pen and paper. So it's more difficult for those athletic trainers to possibly communicate with physicians and PT companies when everything's coming from pen and paper, whereas everyone else is using an EMR system. The culture that encourages a lack of follow-up. In the secondary school setting, athletes don't return to the athletic training facility, or the athletic trainer is not there all the time, which means that daily notes may not be able to be utilized in these two settings. So their athletes may fall through the cracks, or other things may not have the correct follow-up with them. The aim of this quality improvement project is to improve the current level of documentation within the secondary school, to increase the quality of patient care. Will make documentation a top priority for myself. Background: the school that I work at is Beller High School in Beller, Maryland. There is currently approximately 1,500 students with an estimated 700 athletes. We have 15 sports that are offered, and all of those sports have a JV varsity component. I am employed by a physical therapy company within the county, and am not a direct employee with the school. But through our contract, I'm present for all home events and practices, as well as traveling with varsity football and playoff games. Every athletic trainer in the state has to cover state semifinals and finals for every season as well. And currently within my secondary school, I have to use pen and paper for all injury evaluations and soap notes. And since I work for a PT company, there is no expectation to perform treatment and rehab at the school. And if I do it is in conjunction with an athlete being seen in as a PT patient. This is the fishbone diagram for reasons for a lack of quality documentation in Harford County. The four spines of the diagram are time, accountability, culture, and multiple documentation formats. For time, as I mentioned before, there are a lot of things that go on. There are multiple games in one day. The expectation is always to be out at all practices and games from start to finish. When there are multiple games, there's an overlap and no break in between to be able to focus on documentation. For accountability, the only way that we are held accountable for our documentation are document audits that are supposed to be done quarterly, but that does not happen. And the document audits, when they are done, are hastily done, and currently no documentation that we are doing shows our worth and value to the school. Third is multiple documentation formats. Since I work for a PT company, the PT side of things use a computer-based EMR system. However, I do not have internet access at the school, so none of that computer-based system I can do at my school. So with that, I have to use pen and paper, which are kept in a filing cabinet at the school, and the only people that have access are myself and the athletic director. For a culture, lack of a documentation standard from my employer, and really documentation is only really documented and kind of looked over with a fine-tooth comb in case of legal action, and it's not a priority to keep up with by the employer or the employee. So the pre-intervention flow chart kind of shows that it's all over the place. Practice and game days, you're sending kids out to practice and then going out to practice myself. On game days, there's setup and then just having to be out at games, which doesn't leave a lot of time to be able to document the way that I need to before I have to be out at all the practices and games that are going on. So that kind of leaves all the documentation that happens after everything is over. And on game days for each season can end around 9 or 9:30. So that means that there's a lot of late nights that happen. Post-intervention, hopefully with these implementations, the flow chart will be a little bit more pared down with the one of the bubbles that says the AT uses dedicated time to complete documentation, and then after that completes coverage for the day's events. So using that time to get all of the documentation done that I need to get done, and then being able to go out to the events that happen throughout the day. And if anything happens during those events, that's when I would be able to use the after the events are all over to use that time to complete documentation. So for the baseline assessment, the personnel is myself as the athletic trainer, as well as I kind of included the sports medicine supervisor. While she is not directly involved with the project, she would be a good person to help determine the success of the project because she is the one that is supposed to be doing the document audits. So she has an idea of what was going on previously, and if be able to look at the documentation afterwards and see if there is an increase in quality and consistency. For resources, using injury reports, communication logs, patient-rated outcome measures, as well as an employee hour log. With no internet access at the secondary school, I have only focused on documentation that I could do at the school. For the environment, it's the secondary school as well as the outreach athletic training services that I provide. And the implementations will focus on time, culture, and accountability from that previous fishbone diagram. For the design, I started the I started this project January 1st and it ended on April 15th of 2018. There are 3-week cycles for each PDSA cycle, and I did not include Sundays in my calculations since no practices or games can be performed on these days as per the state rule. I focused on improving quality and consistency of all documentation, first by dedicated time for documentation so that I don't feel rushed to complete documentation, as well as feeling confident that everything is accurate and up to date. Secondly, would track documentation process, making myself accountable for my level of documentation each day, and making it a priority to complete and each day, and maintain standards set by the NATA by following the best practice guidelines and being able to show athletes, administration, and my employer the standard of how an athlete training facility should be run. For the first PDSA cycle, I made up the documentation infographic, which is the top right picture, going over kind of the importance of documentation as well as what I should be documenting. And it was posted, or it currently is posted in my athletic training room in a prominent part where not only can I see it, but all the athletes and coaches, co-workers, administration that come in are also able to be able to see it. And I tracked documentation via a planner, kind of just checking off whether or not documentation was either complete or not complete. And for this PDSA cycle, complete documentation occurred 38% of the time, while incomplete documentation occurred 61% of the time. With incomplete documentation, this occurred because of days where practices were not allowed, weather, being sick, and a couple days where documentation was just not completed. For my dedicated time, being the winter season, I found that completing documentation between 3 and 4 p.m. Was the best time, where I've seen enough kids before practice that if anyone does need an injury evaluation, that had been completed beforehand. And most practices had started around 2:30 anyway, so that use of 3 to 4, I was able to check in with practices, but then also focus on documentation during that time. After this PDSA cycle, I noticed that the planner was not the best use, and I needed something that I would be able to see every day as a constant reminder to complete documentation. For the second cycle, I modified the sort of parts of the first cycle. Instead of using a planner, I printed out a blank calendar and posted that underneath the documentation infographic, so it's posted prominently in the athletic training room. I also implemented the use of a color description for the type of documentation, kind of breaking it up from 0%, 1 to 25%, 26 to 50%, 51 to 75%, and 76 to 100%. I also dedicated colors to where there's no school, no practice, as well as whether sick or PTO days. For this cycle, documentation was completed 94% of the time. And with the 2 implementations, I had the best record of documentation for this cycle and had total dedication to documentation for the rest of the project. For the third PDSA cycle, the implementation were to continue to track documentation as well as to administer patient-rated outcome measures, which would be able to show value and worth to athletes, administration, and my employer. Complete documentation occurred 57% of the time, and incomplete documentation, reasons for incomplete documentation were incomplete documentation for 1 day and school-sponsored closures on 2 days, as well as weather-related closures on those other days. No patient-rated outcome measures were administered at this point, mostly because of the timing of this implementation was right at the end of the winter season, where there was a decreased amount of athletes seen for injury evaluation and an increased number of days the school closures. For the fourth cycle, I focused on the new implementation of tracking hours, worked with a blank calendar while continuing to track documentation and process and administering patient-rated outcome measures. Documentation was completed 57% of the time, and incomplete documentation occurred 36% of the time, which were all related to weather-related closures. The patient-rated outcome measures, I administered 3 out of 4 for new injury evaluations. The first 3 were all done in the athletic training facility before practice, and the one was out on the sideline where I had to immediately send the athlete home with the parents and was not able to administer it before then. For the hours, tracking the hours, it was sporadically done because the calendar was left in the filing cabinet. So sort of the reason or a sort of pattern between this tracking documentation hours and the first PDSA cycle of tracking documentation progress with the planner. If it's sort of out of sight, it's out of my mind. So I have to figure out a way to be able to have that constant reminder of tracking hours consistently. As well as the time, the dedicated time, I moved up from 3 to 4 p.m. to 2:30 to 3:30. During this cycle was the beginning of the spring season, so that means that there are more athletes and practices going on all at the same time, but also because of it being spring season, practices or games actually started earlier than they did in the winter season. For the fifth and final cycle, I tracked hours through posting a calendar in the office in a prominent position so that I had that constant reminder and continue to track documentation progress and administer patient-rated outcome measures. Documentation was completed 73% of the time, with incomplete documentation occurring because of the holiday, Easter holiday, as well as weather and sick time. Patient-rated outcome measures were administered in the athletic training facility, and I was able to administer three patient-rated outcome measures to athletes that were seen. I did see athletes out on the field, but again, it's a lot easier to kind of administer them in the athletic training facility because there's not so much going on around me, and it's easier for the athlete to also kind of focus and answer the questions as they honestly. With the hours log being posted in the office, I was able to be 100% compliant on the time in and time out, being able to show when I'm there, as well as what exactly was going on for that day. This chart shows an overview of the complete versus incomplete documentation for all of the cycles. As you can see, the best cycle for documentation was the PDSA cycle 2, and there was improvement seen between the 4th and the 5th PDSA cycle because of being able to be there more because of better weather and less days that the kids were out of school, as well as being more comfortable with the process and kind of getting into a groove of what needed to be done. Overall documentation quality and consistency increased. When a calendar was posted in the athletic training facility, documentation and compliance improved because of being able to have that constant visual reminder. PDSA cycle 2 had the best documentation and compliance, and most of the reasons for incomplete documentation were because of weather-related closures during this time. The administration of patient-rated outcome measures did improve with the best results when given in the athletic training facility and not necessarily out on the field. But there still is a room for improvement even in looking at administering it in the athletic training facility. Tracking hours completed worked best when easily accessible for the athletic trainer. Again, this kind of goes along with the tracking documentation process or progress of being able to see the documentation tracking as a visual reminder to complete the hours worked or the documentation before leaving work for the day. For the lessons that I learned during this project, implementations are easier to administer and study with plenty of planning. It's not something that I would have been able to do just making it up the day of and then trying to implement it. It did take a lot of planning. There was also the need for, 5 PDSA cycles, but each of those kind of worked on the limitations that were seen in the previous one. So being able to study what didn't work on the previous cycles to be able to administer better implementations on the later cycles, it meant that I had to actually sit down and think about and study and plan out before implementing any of the implementations. The second lesson was that the perceived barriers to quality documentation can be remedied. The biggest one that I think athletic trainers struggle with is the time. While it's no excuse for poor documentation, it just means that the athletic trainer needs to figure out what works for them and be able to be flexible with their time and being able to be flexible with how things are, how they want to implement their new implementations. For the limitations, no measurement was done for administering patient-rated outcome measures. So by tracking it through, the way that I tracked it was through the daily sign-in sheet when they checked evaluations. So it's not the best way, and I should probably figure out a new way of tracking that for the next school season, similar to how I tracked documentation progress. And the study was only done over 3.5 months, while this included the last half of the winter season and the beginning of the spring season. This is a very small snapshot of what goes on during this entire school year, and the study probably would have been, may have been a bit more informative if it was done over the entire school year. In conclusion, with planning and execution, barriers to quality documentation can be overcome, and this includes using trial and error over multiple PDSA cycles. I was able to improve quality and consistency of documentation, which meant that I feel more confident in my documentation that it's complete and accurate, as well as being more prepared for legal action. If needed, send my documentation to my employer to look over in any legal cases. I was able to feel like I moved my athletic training facility towards more of a whole healthcare approach, especially by being able to implement the patient-rated outcome measures. And hopefully with all this new evidence of tracking documentation, administering patient-rated outcome measures, as well as tracking my hours worked, I can show value and worth to my employer and to the secondary school. Thank you for listening to my presentation. I hope that it was very informative for you. And if you have any questions, just please let me know. Thanks.